Good day and welcome to today's Dr. Anyoha's podcast. Today, I am going to be talking about eczema. Eczema is one of the most common skin conditions. Simply, eczema is when children have rough skin rashes on their body. It could be anywhere on the body. It could be over their legs, behind their knees. It could be over their elbows. It could be in front of their elbows. It could be everywhere, anywhere when it comes to eczema. And it is known by its rough skin rash, very rough, sometimes scaly, sometimes patchy, sometimes weepy. It can occur anywhere in the body, but mostly extremities like the front of lower leg. If you're a physician or a parent who taking care of a kid with eczema, you run your palms and over their legs, it will feel patchy and scaly and rough. It can also occur on the cheeks, over the cheeks, especially in infants, babies. A month-old baby, 2-month-old baby, 3-month-old baby, they can have patch red skin rashes over their cheeks and maybe behind neck, on their body, the lower body. Those are eczema, most likely eczema. The thing with eczema is its recurrent nature. It comes, gets better and goes away and comes back again. So there's this recurrency of symptoms where the rashes flare up and the parents will do what they can to contain the rash, and after some time it goes away or it seems to get better and then it comes back. It comes flaring up again. So it's kind of one of the parents' worst nightmare, and of course the kids' nightmare. They're scratching, they're itchy, and they can't sleep because of this rash on their body. Like I said, it could be over the legs, over the elbows, behind the legs, behind the elbows as well, in front of elbows, anywhere. The cheeks, like I said, is a very good place where eczema like to attack. Now, I'd like to explain to parents that eczema is nothing but sensitive skin. When some kids are born with sensitive skin, so anything can trigger that sensitive skin to start the irritation and the inflammation and the itching and the rash. So it's a sensitive skin whereby tense environments, weather changes, surfing materials, the detergent stuff is used to wash clothes. When they get in contact with a sensitive skin, it triggers the eczema. It triggers this irritation. Shampoos, when kids put shampoo over their heads and wash their hair, it could drip to the neck and the cheeks and the body and cause irritation, and they develop eczema. These are some of the things that cause eczema. We're gonna go revisit that again in this talk, but by definition, eczema is a skin condition that is recurrent. In other words, it comes and goes, and it causes itchy skin that flares up and gets better and flares up again, especially with weather changes. Sometimes it gets worse during weather changes, especially during certain weather changes. Some kids are known to get worse when the weather changes, depending on where in the world they are. It gets worse during the cold weather. Cold weather makes the eczema get worse, but I think it's an individual thing. Sometimes when a kid plays hard or participate in sports and they sweat, they can trigger the eczema. A lot of things can trigger eczema, but individuals have the tendency, some kids have the tendency to develop eczema, and that what's causing the eczema is not fully known. It's not fully known what's causing eczema. So parents always ask me, what is causing this eczema? The only explanation I can give them is that unfortunately your child has a sensitive skin. Just like children with asthma have sensitive lungs. If they develop cold, runny nose and cough, it can trigger their asthma. Similarly, children who have sensitive skin can develop itching and eczema if the skin gets in contact with things that trigger the inflammation on the skin. So these are sensitive skin and sensitive lungs. And in fact, eczema and asthma go together. Okay, they go together. Some kids who have asthma will have eczema as well. And also sometimes you see what we call rhinitis, which is sneezing, runny nose, itchy eyes, and so on and so forth. So these kids have sensitivity. Their eyes and nose also sensitive to the environment as well. Sensitive eyes, itchy eyes, watery nose, sneezing, stuffy nose, allergies of the eyes, itchy eyes, allergy of the eyes, and allergy of the nose are part of this spectrum, part of this condition that is related to sensitivity of the skin, which causes eczema, sensitivity of the lungs, which causes asthma, and sensitivity of the eyes and nose, which causes what we call allergic rhinitis and allergic conjunctivitis. So these are things that are triggered by the environment, things in the environment, sometimes pollen, sometimes things that you don't even see. This is what eczema is, sensitive skin that produces skin irritation and rash all over. Sometimes when you look at eczema, it depends on what cycle the eczema condition is. It could be dry or it could be very quiet. Some kids, when they come into my office or to the pediatric office, their eczema is under control and is very dry and quiet. But at other times, their eczema is acting up and is very weepy, and there's a lot of scratches over it. So there's a spectrum of features when you see eczema, and depending on what you see, you could still make the diagnosis of eczema, because the skin condition is not always going to be the same way. It's going to change depending on the cycle of the eczema condition in a particular child. And of course, eczema runs in families. It runs in families just like asthma runs in families, just like seasonal allergies of the eyes and nose runs in family. In fact, I see parents, when they bring their kids for eczema, they tell me that growing up they had eczema too, and they outgrew it, which is another good news. People can outgrow their eczema as well. So that is very good news. Just like some kids outgrow their asthma as well. So we've mentioned how cyclical eczema is, which is very, very important. We mentioned how cyclical it is. Sometimes they inflame, sometimes you can catch the kid when the eczema is quiet in the healing phase, and then it's aggravated, and there's itching, and there's inflammation, and it's healed again. So this cycle of healing, aggravation, itching, and inflammation. Healing is brought about by intervention. Parents will intervene in one way or the other. Either they use their locally made medicines or ointments for the eczema, or they give a prescription by their physicians to apply to the eczema. That's how the eczema goes away for the meantime, only to come back again. So it comes and goes and comes and goes, depending on intervention and treatment. So how do I make a diagnosis? So I make a diagnosis very, very quickly. I make a diagnosis very, very quickly because I've seen thousands and thousands of eczema. As a pediatrician who's been practicing for 25 years, obviously, I can call eczema once I eyeball the child. I can call eczema. So I can make my diagnosis very, very quickly when I see eczema. I tell students that come to my office that usually eczema is bilaterally symmetrical. In other words, sometimes when a child has it over the left leg, then you see it over the right leg as well. On one arm is on the other arm as well. In other words, they are laterally symmetrical. When I have it behind their leg, in one leg, left leg, look at the other leg, and you will see that. So there's a bilaterally symmetrical nature of eczema. If you have it on one cheek, you're going to have it on the other cheek. If you have it on the wrist, over your wrist, left wrist, it's most likely you're going to have it on the right, over the right wrist. It's not absolute, but usually they're bilaterally symmetrical. So you see it on both sides of the body. If you look, you can see evidence of that. And of course, the family history is a very good clue as to what the rash is about. When the parents have eczema, then sometimes the kids follow suit and have eczema. And of course, you're also looking for supporting conditions like asthma and allergic rhinitis and conjunctivitis, which means you're looking for asthma, the child has asthma as well, and also if the child has itchy eyes, stuffy nose, runny nose, sneezing, watery eyes. These are all signs of sensitivity to environment, things that cause or triggers asthma, we call allergic trigger. So you're looking for this triad of eczema, asthma, rhinitis. If you get this picture, then you're dealing with eczema, especially if you haven't seen this child before. But if it's a child that you've seen many times, you don't have to go through this diagnostic puzzle. You already know this kid because you've treated him or her many times for eczema, and whenever it comes with a skin rash that looks like eczema, you could determine that this eczema has come back and you have treated again. So that's the way pediatricians approach the treatment of eczema in children. And of course, talking about the treatment, when a child has a mild to moderate to severe eczema, you have to treat with the ointment. Most physicians use hydrocortisone, which is the most basic treatment for eczema. Hydrocortisone, ubiquitous, find hydrocortisone everywhere. But you have to give a high strength hydrocortisone to be able to contain the eczema. There are hydrocortisone over the counter that parents can buy, but those are very low strength, low potency, and sometimes they don't take the eczema away completely, and the patient or the child has to still come to the doctor to give more potent hydrocortisone. I usually start with 2.5% hydrocortisone ointments a couple of times today, and until the rash goes away and parent to stop. And of course, instruct them that when the rash comes up again or about to flare up, to start using the hydrocortisone again. So hydrocortisone is the main stay of treatment, the main treatment used in eczema, and of course they come in different strengths. So depending on the severity of eczema in a child, you can go from mild to moderate to high potency hydrocortisone. The high potency, of course, will have some side effects, but it's always good to start with low potency hydrocortisone and see how this child responds. But sometimes, as a physician, I could also prescribe some prednisone to, especially if there's a lot of inflammation, to at least a short course steroid to contain that inflammation and ease the itching cycle and the severity of the inflammation. So sometimes I do 5 days prednisone by mouth as in addition to hydrocortisone as well. But the most important thing in between is to tell parents to make sure they're using moisturizers, Eucerin cream, Aquaphor cream in between the flare-ups, to use that to always hydrate the skin. Skin hydration is very, very important in children with eczema before it flares up. You have to continuously and daily hydrate the skin with what we call emollients. It is Vaseline, you can use Vaseline, you can use Aquaphor, you can use Eucerin. There's a whole bunch of them out there. But once the condition flares up, it has to be treated with hydrocortisone ointment. And of course, I tell parents to avoid things that could trigger eczema. And those things include some detergents, to use fragrance-free detergents and soaps, and to avoid all the fruity soaps with fragrance, to avoid them, because they could trigger the skin to go into eczema condition. And also, I tell parents to, when they're using towels, fresh towel or washcloths, to use colorless washcloths, because from experience, washcloths that are colored could bleed. Their colors could bleed, and the dyes could bleed, and some patients can react to those dyes in colored washcloths. So part of my instruction is for parents to use colorless washcloths when the child is given a bath. Stress is also known to trigger eczema, so as much as possible, we should make sure the kid is stress-free and avoid stressing the kid out if possible. Another thing is, do not use too much hot water. If you take a bath or shower with hot water regularly, that is too hot. If you dry your skin and it disposes it to eczema and itching, you don't want the water coming from the shower to be very hot because that dries the skin. That's where also moisturizing the skin is very, very important to prevent triggering the eczema from coming back. The most important thing to do is to moisturize the skin and avoid things that trigger eczema, like we stated, and also to, when the eczema comes up, to immediately call your doctor to prescribe some medications to stop the flaring of the eczema. And like I said, the doctors pediatricians usually prescribe hydrocortisone. Prescription strength hydrocortisone is better than the over-the-counter hydrocortisone, except in mild cases. Eczema is of different severity. Some kids have it so severe, others have it so mild. Sometimes the over-the-counter hydrocortisone could work for very, very mild eczema and the kid is okay. Dry skin, flaky dry skin. Those kids could get by with over-the-counter hydrocortisone ointments or cream. But when it comes to moderately severe eczema and severe eczema, prescription strength hydrocortisone is where to go. And you can start from low to high potency hydrocortisone. So there's always help for kids with eczema, and we shouldn't allow our kids to suffer scratching away when we could help them contain this eczema. In addition to steroid creams, we now have non-steroid treatments for eczema that are very helpful, especially for long-term care. These creams and ointments reduce skin inflammation without using steroids, which is reassuring for many parents. They are often used on sensitive areas like the face, around the eyes, the neck, and skin folds. Examples include medicines such as tacrolimus, pimecrolimus, and newer anti-inflammatory creams. These medications help calm the skin, reduce redness and itching, and lower the chance of frequent flare-ups. Many doctors use them to help keep eczema under control after a flare has settled, so the rash doesn't keep coming back. For children with moderate to severe eczema that does not improve with creams alone, there are newer treatments that work throughout the body. One of these is Dupixent, a medication given by injection. Dupixent works by calming the part of the immune system that causes eczema. It does not weaken the entire immune system. Many children on Dupixent have less itching, fewer skin flare-ups, better sleep, and better quality of life. Parents often notice that once the itching improves, everyone in the home sleeps better, and that's a big win. It's important for parents to know that eczema treatment has improved a lot over the years. We are no longer limited to just one or two options. Some children need steroid creams, some do well with non-steroid creams, and others may need advanced treatments like Dupixent. The goal is always the same: calm the skin, stop the itching, prevent flares, and help children live comfortably. With the right plan and close follow-up, most children with eczema can do very well. To recap, eczema is one of the most common conditions I see on a daily basis in pediatric practice. In fact, over the past month, I've seen at least 2 kids with eczema per week. And of course, in different cycle, some of them, the eczema is worse than the other. And what I do is make a diagnosis, refill their medications, for eczema if they ran out, and also treat them for other things that come with eczema, like we said, asthma, nasal and eye allergies. Those are the things that usually go with eczema, because all these conditions are due to sensitivity, environmental sensitivity. So thank you so much, and please share this podcast with your friends and family. This is Dr. Anyoha. Thank you.